what are some other lifestyle modifications that would complement the use of PERQUE Mood Guard, maybe even in particular to seasonal affective disorder?
Well, yes, good question. So with regard to PERQUE Mood Guard, is it the thing that everybody needs, and does everybody need it? No, there's nothing that everybody needs, and so we can put that to rest. There are certain kinds of mood disorders. I mean, serious endogenous depression, certain kinds of bipolar or manic depressive behaviors. Would I give the PERQUE product to such a person? Sure, but it may not be sufficient. For the right person, when you take the product at the right time of day, and often in the right combination. So for example, some people, some clinicians have reported to me that when you take the combination of PERQUE Mood Guard, Sleep Guard, and Detoxin Guard at bedtime, that you get more restorative sleep, you're able to remember your dreams, you're able to stretch out rather than contract during your sleep time. But not everyone has that. And certain people will tell you that if they take the Detoxin Guard or the combination that we're talking about, it keeps them up. So those people should take it in the morning. So there is, with regard to how remarkably safe, how remarkably effective the PERQUE products are, when you take them, what you take them along with, as well as the understanding of the person, are variables that the wise health coach, the wise health professional, can use to decide for whom, when, and how much. In contrast, something like 80% of the reason why people go to a physician is for fatigue, irritability, mood problems. We have a first-line comprehensive approach to most of that issue, recognizing that there are limits, and sometimes you just need to take a walk in the woods, sometimes you need to talk to somebody, sometimes you actually need a prescription medicine. So for the supermajority of folks who have a cloud hanging over them, who don't have a joy of living, who used to enjoy the aromas of food more, but now they find everything's kind of the same. That kind of acquired, very common, and very commonly underappreciated problem very often causes people who start on these PERQUE products to report back to their professional, oh my gosh, I didn't realize that I had this cloud hanging over me. I didn't realize I had acquired this sense of hopelessness rather than hopefulness. I had decided that there was little I could do about the challenges of my life. Now I see there are opportunities, whereas before I didn't see them. It's remarkable how often people will say that. How helpful it is for the supermajority of people who can use some mood enhancement. Knowing that there are limits and there are times when people have a very serious problem, a medical psychiatric problem. And yes, the right diet helps. Yes, the right attitude helps. Yes, the right exercise helps. Yes, the right supplementation helps. But there are limits to all of that. And important to know when to call for help and when to call for PERQUE and when to call for both.